Dr. Barry Chaiken is a futurist, informaticist, and author. He's president at Docs Network, and his book, Navigating the Code, calls for the use of revolutionary technology to transform the patient-physician journey. He believes IT is healthcare's greatest problem-solving tool for resolving the greatest medical and business problems of the 21st century. Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the HealthBiz podcast, a weekly show where I interview top healthcare leaders about their lives and careers. If you enjoy this episode, please press that like button and subscribe. Dr. Chaiken, welcome to the HealthBiz podcast.
Hey, thanks so much for having me. It's great to be with you today.
Outstanding. I want to talk about, obviously all these this upcoming revolution. They say the revolution, they say will or will not be televised. I don't remember. But before that, I want to talk about kind of your background, your upbringing, and go back all the way to your childhood. Any childhood influences that have stuck with you throughout your career?
I'm really glad you asked that question because I like to share this story with people because in reality, I came from a very humble beginning. My grandparents came over on a boat from Europe as teenagers, all alone. Barely got a high school education. I don't even know if they graduated. My mom and dad never went to college. My father used to work 6 days a week. My mom used to work also. I was one of these, what do they call them? Latchkey kids.
Latchkey, yeah.
I would come home and, there were times I forgot my key. I had to break in through the window to get into the house. Mom wouldn't get home till 5 o'clock or 6 o'clock at night. We never went on vacations because we didn't have any money. I went to public schools in Brooklyn, New York, public school, and then junior high school, and even high school. I was the first graduating class of a brand new high school located in Brooklyn, which subsequently is closed. And then I went on to do public school where my university was public and my medical school was public. But you asked about people who influenced me being young. And I know this is going to sound like a little bit of a strange story considering I'm in medicine, but when I was in the 10th grade, which is the first grade that I was in high school because I skipped a year, my English teacher was a guy named Ernie Seligman. And he was very, how should I say, humble. He always believed in doing the right thing. And I was in his English class. They were forming a student newspaper. I became editor-in-chief of the student newspaper, which I did for 2 years. And then my last year, I was editor-in-chief of the student yearbook. But the thing that was important about Ernie was that all of these other people who joined the newspaper at the time, and remember, we were in 10th grade, so we were 14, 15,
Yeah.
Maybe the oldest person was 16 years old. Ernie was so influential about doing the right thing all the time. And it meant that you did the right thing as it applied to your community or where you lived. It wasn't all about you. You weren't supposed to be selfish about the decisions that you made in your life. And I'm really proud to say that so many of the people that I work with and that student newspaper, right? One of them was the editor-in-chief of the Sci-Fi Network. Another one wrote 10 different novels that have been published. A third one was a very well-renowned cancer specialist, went to medical school and did some research in cancer work. And there are a variety of others. One was also one of the first chief technical officer at the New York Times. These are all these people that worked as, snotty nose, acne kind of students in high school. And Ernie was incredibly influential to me and a variety of others. And we still, to this day, every once in a while, all of us get together to talk about Ernie.
Nice. That's wonderful. And what did you do, after graduation, going to practice? What were some of your career highlights sort of earlier on in your career?
Well, when I was in medical school, I went to the Harvard School of Public Health to get an MPH degree. I was very much interested in public health at the time. And after doing some internal medicine work, I went on to worked at the CDC as an EIS officer chasing epidemics. I have to say, not as exciting as the last 3 years, but exciting enough. And what I did was I learned a tremendous about epidemiology and statistics and such. Back in that day, I used to do what you call them attack rate tables to see, comparing the cases versus controls. And I would do it through a spreadsheet, right, on paper. And I thought it was great. I got access to an IBM PC, and I actually had a spreadsheet that I can do it electronically instead of spending 4 hours doing all the calculations right on a spreadsheet. So I learned a lot there. And then I did a preventive medicine residency with the state of New Jersey, and then got involved in business and being entrepreneurial and doing a little bit of research after I came back to Boston from being in Pittsburgh and in New Jersey.
Got it. I mean, epidemiology in some ways isn't that sexy and exciting, chasing, pandemics and epidemics, but there is some exciting work and going back to, like tracing the source of an outbreak in London to, a certain well or whatever. Like there is some sex appeal of that business, isn't there? Or there was in the olden days.
Well, John Snow was the first epidemiologist, right? Where he supposedly, the story goes,
Yeah.
he went ahead, took the handle off the pump, and boom, you go, it stopped the epidemic. Because in those
Yeah.
days, the drinking water came from the Thames River, and Gat was the same place that people put their discharge into.
Yeah.
So it was a bit of a problem at the time. Interesting public health note, right? The most effective thing to save lives in medicine in history was clean water and sanitation. We think of it as these miracle drugs and all this other jazz. It's clean water and sanitation. And back in the day, you heard about, in the 1800s, 70 and earlier, people serving beer to their children. The reason they did that, it was very low alcohol bill, not like the craft beer we see today. But the reason they did that is because when you make beer, you basically sterilize the water.
Yeah. Yeah.
And it prevented the people from getting sick.
I remember going to Boston Children's Hospital and looking at their history there, and you see these cows that are, out in front, and they always tell you it's not because this Boston was a rural area, but there was adulterated milk in Boston, and they made sure that they had their own supply that they could keep an eye on. So I'd like to think we've come a good distance since then. I don't know some days.
But the thing to remember is the principles are the same.
Yeah.
Right? Even if you're talking about, all this stuff like in the pandemic, the principles are basically the same. Tracking and tracing and collecting statistics and also changing your mind, changing your theory about things based upon the new data that you collect. That's the wonderful thing about science and critically thinking is when you get new information, you got to change your mind. So what we thought about the pandemic and back in March and April of 2020 is not what we thought about the pandemic a year later, for sure, because we had a lot more information. So it wasn't like the people were wrong back in March and April. They doing the best guess based upon the information that they had at the time. And then they have to change their view of the world based upon new data, which is what we always want to do.
So I see, as I look on your LinkedIn, I see this Docs network, which you've had for a long while, even as you've had some of these other sort of roles. What is that? How has it evolved over time?
Well, I formed Docs Network as a vehicle for me to be able to do my consulting outside of the times that I'm working full time. And additionally, as a vehicle to establish my identity, in the business world. There are obviously legal and financial issues associated with forming a company, but I did it for that. And I've done my consulting through that. So right now I'm focused on doing it, presenting my thought leadership with it. I'm involved in keynote speaking, and I'm on several speaker bureaus, and that's what I'll use Docs Network for. It's that type of vehicle. If I am able to get a particular consulting contract and opportunity, I might bring on colleagues to help me do that project. So it's really the vehicle that I'm able to do my work. And I know that a lot of people on this podcast are interested in how do you go ahead and start your career. Frankly, it's really important to have a corporation as part of that process, because it establishes you as being somebody real and responsible. And obviously, the legal and financial issues associated with tax considerations and such. But that's what I use Docs Network for. I haven't to date built it up into a larger consulting group with employees and such. That hasn't really been my focus.
Yeah.
I've mostly been focused working for corporations, so I haven't been taking it down that path.
Sounds good. Well, I want to talk about your book, Navigating the Code. And the first question is, why write it?
Well, for the last, almost 25 years, I've written thought leadership on a variety of topics. And I realized about 2 years ago, I said, I wrote all of this stuff, and wait a minute, I'm reading about stuff that other people are writing about that I wrote about 10 years ago or 15 years ago, and the topics haven't changed. And what's really, really funny is the solutions haven't changed. The people have the same solutions. We haven't actually implemented them. And I said, it's really time for me to take this information and put them into a book. And here's the other thing I wanted to do. I saw all of these other books on healthcare and health IT. And you know what they do? They complain about the healthcare system. They complain about this and complain about that. When I decided to write this book, I said, my book is not going to be about complaining about what's wrong. It's going to be about solutions to help people be successful and not make it perfect, just make it better. Because in the books that I read, it'd be 300-page book, 280 pages was what's wrong with the US healthcare system,
Yeah.
20 pages with how to fix it. Well, the how to fix it part, it needed to be switched around, right? And the other thing I did was I said, so many people are writing books. Our attention spans are much shorter. There's so many more pieces of information available in a variety of areas. I said, I need to do something that'll make it easy for people to consume the concepts that I want them to learn about. So what did I do? I wrote a business book, not a textbook, and I wrote a business book that would be entertaining. And how do you make a book entertaining? Well, you do it a couple of ways. You got to break it up into different pieces. I did interviews with people from all over the world, 18 of them. When I say all over the world, I'm talking about Singapore, Brazil, Chile, Saudi Arabia, Pakistan, the UK, Australia, as well as the US. And I tried my best to identify experts in various areas and have a level of diversity of thought about those. So it gave people the opportunity to, well, I don't want to read the whole book through. I can go ahead and read about, David Shulkin, for example, who's a former VA
Yeah.
secretary, or John Glasser. And additionally, I have what's called these bedside consults, which are these little breaks of stories. So in my book, I have Elon Musk, stories about Elon Musk, stories about Shakespeare, Monty Python, Moneyball, Star Trek, because I said, if you can't sit on the beach in Cape Cod with your feet in the sand in the summer and be able to read my book, then I have to fix the book.
Sounds good. I love to go to the Cape in the summer, actually. So I will try it out there. I want to know though, so a lot of times people I hear about, medicine, no technology, medicine is, 10 years behind or something. But I hear you say sometimes about you do things in medicine the same way from 50 or 75 years ago. I mean, is this just hyperbole or why is medicine so out of date in certain areas?
For those of us who've been trained in medicine and in nursing and our healthcare professionals, one of the things you want to do, and we know this from the code, do no harm. So the way you do no harm is to be conservative in the new things that you try to do. Because the last thing you want to do is, I've always treated a patient a certain way, and most of them have gotten better. And therefore, I don't want to change what I'm doing because they've kind of gotten better. Things are changing today, but I wanted to set this as a framework or a foundation for us to look at. You don't want to do the wrong thing. And what we do also know from studies is that if you were trained at Harvard as a medical school or internship, residency, fellowships, you then end up practicing like people at Harvard do. If you go to Stanford, you practice different. If you go to Wash U in St. Louis, you practice different. In Colorado. So there's all of this regional differences. Why? Because you're trained a certain way, you feel comfortable with it, and it's really difficult to take the chance to change, because if you change and you have, say it's a 1 in 1,000 chance of a bad outcome, and you do that change and the first one is a bad outcome, then you say, well, I can't do the other 999 because that proves that it's a bad outcome. So that's a little bit of it. The other thing is that medicine has gotten so incredibly complicated. Example, precision medicine, genetic testing, things like that. So we know a lot more about patients than we used to before. There are a lot more treatments available than there ever used to before. And everything's changing so incredibly fast than it ever did before. I believe no human being, I don't care how smart you were, I don't care if all the doctors were Einstein intelligent, there is absolutely no way you can absorb the information, process it, and apply it. And that's why I believe that the way we practice medicine has to change to include, to offload those types of things, learning new stuff, processing it, digesting it, so the physician can focus on things that humans can do very well, which is understand the patient's social situation, capabilities, and even apply some empathy and compassion for that patient to get them to follow through on therapies. So to answer your question, some things have not changed, but a lot of things have. It's just they need to change a little bit faster. And the last thing I want to say is I strongly believe us here in Boston have access to some of the best medical care in the entire world, but there are people in the Boston area who don't access it. There's no reason why, no matter where you live in the US, right, that everybody should not get the best possible care, at least in the protocols, at least in the therapies, at least in the treatment schemes. They should have access and be able to get that best possible care. The techniques or the skill of a surgeon is different. Think of that as being a basketball player or a baseball player who has this special skill set. You can't reproduce that. We can have a minimum standard of competency, but beyond that, there's no reason that a cancer patient being treated at Mass General Brigham or the Dana-Farber should not get the same, someone outside of those two institutions should not get the same quality care as people inside those institutions. Because we know what we should be doing. Everybody should have access to that best possible treatments.
So I can understand, I think, how if you've got things that are changing quickly, they're complicated, they're broad and all that, that may lend itself to technology or information technology solution. Some of the other things that are kind of cultural or baked in with the do no harm kind of go against that. So with all those kind of forces in mind, do you think that health information technology can really make a big difference, or is it more held back by some of these factors that just you won't be able to change, even though you're suggesting, let's practice in a different manner?
Change really anywhere doesn't happen from the top down. It happens from the bottom up. So in a lot of places, I've seen the use of analytics as an example. A lot of times it started in a department, moves on to another department, before you know it, the entire hospital is using analytics. And then there's a need for having an analytic strategy to be able to change behavior and report back on things. So what we have to do is we have to figure out, what are we trying to accomplish? Because you can't boil the ocean. It's silly to put in an application, any type of health IT, without having a purpose. One of the things they taught me when I was an ES officer at CDC was, don't ask for a piece of data that you do not think you're going to use, because you only can collect X numbers of pieces of information, because patients will get tired if the questionnaire is too long. So the same applies here. Figure out what you want to actually change, what you believe and why you want to change it, how you're going to measure whether the change is going to be effective, and then think about using the health IT tool to be able to do that. And it's incremental. It's not a big program. I'll make a change here, I'll make a change here, I'll make a change here, I'll improve this, I'll improve that. And before you know it, you add up all these changes and good things happen. And one last piece, which is very psychological, they have looked at people who are very successful in life. And one of the things they found out is that people who are successful in life choose small interim goals on their way to their bigger goal, because when they achieve that little change, right, they feel good, and that encourages them to do the next thing. Now, that principle should be applied when you're trying to do change management from the bottom up. Choose something that's small that you think you can accomplish, create a metric, find the metric for it, measure it, report back the metric, celebrate your success, and then move on to the next one. And over time, additively, you'll make things much better.
So one thing that's changed recently, at least in the public discussion and maybe beyond that, has to do with generative AI like ChatGPT that's out there now. And while you're talking about sort of the life success of these incremental and small goals, there is at least a sense, including by some of the big thinkers out there, that now we're into a sort of an exponential mode, and the human brain has trouble kind of understanding that and grasping it. By the time we look at it and analyze it, it's going to be too late. And I think a lot of people are there was a, just recent letter saying, let's actually stop this for a while because we're on a death train or whatever it may be. But what is your sense of how and whether sort of this new frenzy on the generative AI side interacts with what you've just described?
That's a really good question. I saw the article. It was written by a variety of tech leaders. I listened to a recent podcast about this with somebody who's being reported from Vox. Um, there's a real problem with generative AI, which is unless we take control over it and manage it, it can run away. And I recently wrote a post on LinkedIn about this and said, I believe we need this non-proliferation treaty around things like generative AI, because unless we have some guardrails, we have no idea where it's going to go. And it's so complicated that it can go in directions that are not going to be very good for society. And I'm not talking about they're going to, the generative AI is going to create all this other stuff, and then they're going to take over and they're going to come up with something that's going to destroy the human race. Although I think that's all possible. As a matter of
Yeah.
fact, some of the researchers think there's a 10% chance. Some think it's more. But let's not go there. Let's talk about medicine, for example. The biggest problem with using AI in healthcare is the data sources that feed the model. That's the problem.
Yeah.
And if we are not careful about how we choose those data sources, then we are going to create models that are going to deliver answers or suggestions or directions that are not going to be appropriate for us. So, for example, if you want, this is a very stupid example, but it's very specific. Everyone will understand this. If we wanted to know what the risk factors associated with breast cancer, it would be quite foolish if we went ahead and only had males in our data set. Now, it sounds really dumb, but those types of problems occur across race, sex, orientation, ethnicity, country of origin. There's a whole variety of factors. And what's really funny, it gets back to the whole idea of epidemiology and subsets of populations and stratification. So we have to be really careful when we use this AI and how we're going to apply it, because it can make a huge difference. Last thing, if we apply it and it has bad results, then we might reject it completely. And then we have a problem of we're not taking advantage of a tool that could be really helpful to us. So we got to step slowly, know what we're doing, and be transparent about how we're doing things.
Yeah, I think it would connect some of your comments back to what you said before about someone who practiced it, went to Harvard or Stanford or whatever. They're going to practice like that. And at least they have the idea to say, hey, gee, maybe I need to look around and interfere, relate with some of my other colleagues from other places or graduated in other years and so on. The thing with AI, you could actually really entrench something if everybody's, practicing based on a given data set that has some sort of a bias in it.
That's absolutely true. And here's another example of that. All of us, when we buy an app, right, we see that the user license, I have not met one person in my life who ever read it, right? Even attorneys, they don't read it, but we take it for granted. The way we take it for granted is the same way we would take AI for granted over time. Yeah, we can go ahead and examine the model. Yeah, we can go ahead and examine the data set, but we may not do it because we're busy and we want to get on with what we're doing, right? And that's the risk. If those types of bad AI, right, or improperly configured AI becomes part of the mainstream, whether it's in healthcare or outside healthcare, we get the problem of we might be doing things that really aren't really good for us.
Yeah, I think we could go on endlessly about this. I'll mention one other thing that I start to use these tools myself, even to write podcast questions, and I had and it usually can provide some good questions. I was doing an interview with somebody the other day, and went through a variety of things, and it proposed had some reasonable questions. And it proposed a question, now that you're a parent yourself, what do you think about this, that, and the other? And I realized I don't believe this person is a parent, and it's not sourced anywhere, and it's sort of, what made it think that, I don't know, but it appears as a question that I was able to say, well, wait a minute, is that likely given this individual? But whereas you definitely skip right past it, and as things get more, not everything is as clear as that. Maybe I skip by, something else. And if you have something like that in the medical record, after the person, after the patient, was cured of hepatitis in 2017, this happened. So maybe they never had hepatitis in the first place. It just made it up from somewhere because we don't understand the models or the data.
That's a really good point, because what people need to understand about AI is that you just give an example of understanding truth and falsehood. So as human beings, we can use our experience, knowledge, and intuition to guess truth or falsehood or question something. These AI models don't know the difference between truth and falsehood. So, for example, you can go ahead and give them access to the whole entire data set of all the conspiracy theories in the world, and what they'll come out of what they generate from their AI will be
Yeah.
eye-opening and ridiculous, because you as a human know that from other data sources and experience that it isn't true. And that's the real risk, is that people need to understand, it's really important, that when AI generates a response, they take it from their data set, but the data set by them, by the AI, is not judged as being true and false. It's just data.
Yeah. Yeah. All right. Something to think about. So, in your book, I think you talk about 5 different parts of the solution. You described before about sort of breaking it up and giving, different pieces and all that. And I wonder, just at a high level, if you might be able just to share, what are the 5 parts, just so people have an idea of the arc of the book.
So I broke the book up into 5 different parts so people can digest it. I was always thinking about them digesting it. So I wanted them to understand, what problem we were trying to solve, what tools are available, the importance of change management. And what's really important about change management is, and what's so difficult about it, is it involves people, right? So you can't, I guess you can order people around, but
Yeah.
in this country, not so much. So change management is really hard. How to apply information technology tools, and then get people to think of what they might actually accomplish in the end. Um, in a lot of ways, the book was laid out as a call to action and giving people tools, and most importantly, encouraging them to take the risk to start to do something. And again, it was about these small incremental steps, almost grassroots. And I took a couple of other things that had been done back in during the 1940s and 1950s in development of aircraft and such, with these skunk works, which is
Yeah.
basically bring people together who can get stuff done. The important thing is to get stuff done, and also to do it in a positive, transparent way, to get buy-in from others. It's, again, not top down, it's bottom up.
Great. So, what's the reaction been? And after kind of hearing the reaction, are you feeling more or less confident that the revolution will happen?
Well, I'm not famous enough to have sold 100,000 copies of the book and been
Yeah.
on Oprah and all of the Sunday TV talk shows. So it's really hard to say. And I think I was a little bit ahead of time, when people wanted to think about stuff, because I think most people are still thinking about the burden of the EHR
Yeah.
on the physician and the nurse. But I think the concepts still ring true. When people have read my book, they've enjoyed it, even people who are not in the healthcare space per se. So I'm really pleased with the way it came out, and I'm thinking of doing another one in this place, maybe using some generative AI to help me write some of that book. As a matter of fact, I wrote a piece that I posted on LinkedIn as well as my website, where I asked it to write a particular article, the
Yeah.
generative AI, and I had it do it 3 times, and then I pasted together the paragraphs that I thought made the most sense. But
Yeah.
again, I didn't write any of it. It was all written by the generative AI, but it had the overlay of me making the changes to make sure it was accurate, made sense, and that it came together.
So, when you're not writing, what are you reading, and anything you would recommend?
Well, there are 2 books that I read that I thought were really influential. One of them was pretty old, but when I read the book, I read it in the late 1990s. But what was so wonderful about the book, it made me understand the whole concept of digital, which everything at that time was mostly analog. And because I read that book, everything I did from that point forward, I completely understood what digital, metadata, all that other stuff, and it was a book called Being Digital by Nicholas Negroponte. He was at the MIT Media Lab. I mean, if you can find it, read
Yeah.
through it. And if you don't get the digital stuff, that's really great. There's another book that I read was called The Good Job Strategy. And if there's anything relevant today, it's that book. It was written by Zena Tom. She's now at MIT. She has the Good Jobs Institute. She's coming out with the second book. And what I thought was so amazing about that book was it gave examples in the face of what we think is typical capitalism and commercialism. She said, if you go ahead and train people well and give them jobs and flexibility and trust them and cross-train them, you can have an organization like convenience stores with a gas station. You can make it incredibly profitable, have a lot less turnover, make your employees really happy, and actually make more money. And she gives several examples of that. And I thought that was really great. And I'm really reading this book now by Barry Nailbuff called Split the Pie. And this is really valuable to people because it's helping you think about how do you negotiate in a completely different way. And the concept he has in the book is it's not about what you want to pay and I want to accept. It's about what are we really negotiating over. We're negotiating over not the difference between the price you want to pay and the price I want to accept. We're negotiating over a variety of other issues that are associated with that. And what you have to do is you have to dig down and understand what the differences are. And then you negotiate over that piece. And Americans tend to split the difference. Well, he says, yes, you split the difference, but you don't split the difference between what you want, what the person wants to pay, and what you want to accept. You split the difference, the real difference, which is exploring what is the difference, what are the upsides and downsides for each party, financially and otherwise, evaluate them, and then you negotiate on that, or actually split the difference on that.
Nice. Well, Dr. Barry Chaiken, futurist, informaticist, and author of Navigating the Code, thank you for joining me today on the HealthBiz podcast.
Thank you for having me.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.